Hello, this is Dr. Lowell Keppel here, and we're going to talk about GERD, gastroesophageal reflux disease. Many people suffer with this, and some of the symptoms that they have with this are acid reflux, burning, heartburn in their esophagus. Some people will get a lot of mucus. They think they might have some sinus or allergy problems. Some people will get some headaches, but another very subtle sign of the GERD is a dry, non-productive cough. And a lot of times they'll think that they have lung issues, when in reality it's just a stomach issue. So what causes GERD? Well, GERD can come from several different factors. One of the ones I see a lot of is people that have been in car wrecks. Now, what are we going to do about this? Well, GERD is primarily a structural issue. In other words, the stomach is not sitting in its little pouch the way that it should. And now this opening at the top of the stomach that allows the food in and supposed to keep the food in, this valve can get stuck open, allowing contents of the stomach to come back up. And that's what's creating the symptoms. So there's some things that we can do to help this out. As a matter of fact, we've helped a lot of people avoid surgeries for this very condition. Well, we can take a look at homeopathic remedies, and I use the NET remedies, and one of the main ones that I found very productive in helping this is called visceral polarity. And then we also may need to use some nutritional supplements. So along the standard process line, we will use what's called Calsol, which is a calcium phosphorus supplement, vegetarian formulation, and what it does is it helps the sphincter valves open and close normally like they should. And many times we'll use a product called Ligaplex. Ligaplex is a combination product that helps with ligaments and tendons because your stomach is also attached to your diaphragm, which is basically like a ligament. And so we need to help get these structures stronger and healthier. Now, I said a little bit earlier that it's a structural problem. So the stomach sits in a little pouch. It has what's called fascia around it that helps it stay where it needs to be. And sometimes this fascia can become twisted. For instance, certain breeds of dogs, like boxers, have been known to get stomach twisted, which could actually cause them to die. Well, the same kind of thing happens with patients in humans as well, but it doesn't twist all the way around. Think if you take somebody's arm and you give them the old Indian rub. Think about how you feel the stress on those tissues. Well, that's the same kind of thing that happens in the stomach. So what we have to do is we have to literally pull the stomach down and clockwise. Now, I had a practitioner ask me the other day, is it clockwise when you're looking at the patient or if the patient's looking down? And the answer is yes, because both of those are in a clockwise direction. So your doctor would want to get on this stomach, pull it down, and turn a little clockwise. Now, this is not violent, but you have to put a fair amount of force into it. Now, the other secret component that I found to fixing these GERD problems is what's called visceral manipulation or rib torque. Okay, rib torque. That's where the whole rib cage as a unit gets twisted. And now this stomach and other organs can't attach to the ribs the way that they should. When people have this rib torque, they'll also get a lot of neck pain, and they'll get pains that go down their arms. Some people call that thoracic outlet syndrome. So what do we do for that? Well, we can take the ribs and in a gentle fashion, pull the ribs back around, which now takes a lot of stress off of the muscles and off of the diaphragm. Then we can, as chiropractors, we can do an adjustment on your first rib heads because these neck muscles attach into those first rib heads. And then we would also do an adjustment on your thoracic spine. By fixing this rib torque, we now are balancing the body so that where the fascia of the stomach attaches into the ribs can normalize and take that stress off the stomach and decrease that GERD. Now, we've helped a lot of people with this procedure over the years, and we've helped people that were supposed to get surgeries, and they were able to avoid that by having this procedure done. The important thing is your doctor needs to look at all the factors involved. Just like I stated, there could be a homeopathic remedy involved. I mentioned NET remedy, visceral polarity. That helps with the organization and the balance of the tissues. And then we talked about some standard process products, Calsol to help this valve at the top be strong so it can stay closed. And we talked about Ligaplex 1, which is a formulation to help ligaments, which like your diaphragm is. So thank you for watching this video. If you have any more questions, please feel free to contact me at drkeppel@gmail.com. That's Dr. Keppel at gmail.com.